This is a GCSE Physical Education exam paper, Component 1, Fitness and Body Systems. It's the exam board Edexcel and it's the year 2018. The paper starts with multiple choice questions. So question 1A, which one of the following bone classifications is most suitable for weight-bearing activities? Long bone, flat bone, short bone or irregular bone? So each bone classification has a specific role in the body, and the one that's best for supporting the weight of the body and weight-bearing activities would be the short bones, which are found in the tarsals of the ankle and the carpals of the wrist. Small cube-shaped small bones, short bones, which are very good at supporting the weight of the body. Long bones, very good for leverage and movement and blood production. Flat bones, excellent for protection of the vital organs. Irregular bones, good for movement and also protection, for example the patella in the knee joint. Question B, which one of the following is a region of the vertebral column? And the options are clavicle, pelvis, cervical and sternum. The clavicle would be the collarbone. The pelvis is at the hip. The cervical is a region of the vertebral column, and the sternum is the breastbone in between the ribs on the front of the body. So the correct answer, which one is a region of the vertebral column? It would be cervical, which is the top section of the vertebral column. C, which one of the following is the correct classification of the knee joint? Is it pivot, ball and socket, condyloid or hinge? Now all of these are types of synovial joint at different parts of the body. The knee joint can only move in two directions, flexion to bend and extension to straighten. So that means the knee joint must be a hinge joint. That's a type of synovial joint. The pivot is found in the neck, the top two bones, the atlas and the axis. Ball and socket at both the hip and the shoulder. And the condyloid joint is found at the wrist. D, which one of the following correctly states the role of ligaments? The correct answer for ligaments is to stabilize the joint so it joins bone to bone. Joining muscle to bone would be a tendon. Okay, we have question E, which one of the following blood vessels takes oxygenated blood away from the heart to the body? The pulmonary vein takes oxygenated blood from the lungs back to the heart. The pulmonary artery takes deoxygenated blood from the heart to the lungs. The aorta will take oxygenated blood away from the heart to the body. And the vena cava takes deoxygenated blood back to the heart from the body. So the correct answer is C, aorta. F, identify where gas exchange takes place. The bronchi, the alveoli, the bronchioles or the diaphragm. Gaseous exchange takes place at the alveoli. G, which one of the following performance-enhancing drugs, PEDs, is an athlete most likely to take to increase their power or strength? So the options we have are beta blockers, anabolic steroids, diuretics or narcotic analgesics. Anabolic steroids is the correct answer. Although it won't automatically increase the power or strength, it will allow an athlete to train harder and recover quicker from training so that they can eventually make those gains in power and strength. We know this because the other options certainly don't work to increase power or strength. Beta blockers will slow the heart rate down and therefore improve accuracy in sports such as archery. Diuretics will increase the body's urine production and therefore dehydrate the body to lose weight. And narcotic analgesics will mask pain of an injury so that an athlete can go ahead and play sport despite injury and play through the pain barrier. H, Which one of the following PEDs is an athlete most likely to take to increase oxygen delivery to their muscles? Is it stimulants, erythropoietin, EPO, growth hormone, or beta blockers? The correct answer for this one would be EPO, as this is a performance enhancing drug that increases the amount of red blood cells and therefore the oxygen delivery to the muscles. Stimulants would increase aggression and reactions. Growth hormones would increase gains in muscle size and help the body to grow and recover from training. And beta blockers, as we said before, was to slow the heart rate down. So to increase oxygen delivery is definitely EPO for the gain in red blood cells. Question 2. Figure 1 shows the muscular system while running. And we have a diagram here, figure 1, labelling here A, back of the leg, B, and C down here, the lower leg. So the question, what it asks us is A, identifying the muscles labelled A, B, and C, and then part B, state the role of each muscle. So muscle A would be the bicep muscle, muscle B would be the hamstring, and muscle C would be the gastrocnemius. So first we have to put those into the table at the bottom. Muscle A would be the biceps, muscle B would be the hamstrings, and C, gastrocnemius. Okay, so state the role of each muscle. The biceps, we have flexion. Hamstrings, we have flexion at the knee. And gastrocnemius would be plantar flexion. Question 3. Figure 2 shows a long jumper. Examine the antagonistic muscle action taking place at the elbow and the hip in figure 2 that allows the long jumper to achieve this position. So this question is worth 3 marks for what you can say about the muscle action, the antagonistic muscle action at the elbow, and then another 3 marks for the antagonistic muscle action at the hip. So if we look at the diagram, we can see that the elbow is straightening. The agonist there would be the triceps, which is contracting. The antagonist would be the biceps, which is relaxing, which allows extension at the elbow. And the hip is flexing, it's coming forward, and therefore the agonist would be the hip flexor that's contracting, and the antagonist would be the gluteus maximus, which is relaxing to allow that movement to take place. So for this question, examine for 3 marks. We've basically got to give 3 facts about the elbow and that antagonistic contraction, and then 3 marks for the hip. So I'll show you the best answer for that. Question 4. Figure 3 shows the steeplechase athletes running a race. The race involves running 3,000 meters, running here, and also jumping hurdles. Examine how 2 different muscle fiber types are used by the athletes in figure 3 during different parts of the race. So it's suggesting that for the 2 different parts shown, perhaps a different muscle fiber type would be most beneficial to the athlete. We know that there are 3 muscle fiber types. One would be the slow twitch muscle fiber type, which is very good for long distance running. So in this part, running the 3,000 meters, quite a long distance. And we know that that is slow twitch type 1 muscle fibers. And then we also know that you have type 2X, so fast twitch type 2X, which are good for powerful explosive contractions, which would allow them to jump over the hurdle of the steeplechase. Also, there's type 2A muscle fibers, which would be good for putting in a prolonged sprint or a fast lap on the steeplechase. But as we only need to talk about 2 different ones, we'll probably use type 1 for the running and type 2X for the jumping of the hurdle. So what we need to do here, this question's worth 6 marks, is we need a point explain benefit about slow twitch fibers and a point explain benefit about type 2X fast twitch fibers. So here is what I would put for this answer. Okay, so the first part, for running the long distance 3,000 meters of the steeplechase, the athlete would use mostly the type 1 slow twitch muscle fibers. So that's your point. These fibers are good to keep working aerobically over a long distance, that's explaining it. And this will allow the runner to keep going and not fatigue. So there's the benefit for that one. So now we need to do another developed statement for jumping the hurdles. So we have, for jumping the hurdles, the athlete would mostly use type 2X fast twitch muscle fibers. These are very good at fast explosive contractions, so we have the point and explaining the point. And finally the benefit, this would allow the athlete to push off the ground and clear the hurdle. Question 5. Figure 4 shows a boxer who has a cut to the face. Part A. Explain why platelets are important to athletes in contact sports such as boxing. It's 2 marks. It's an explain question, so we have to give a point and then give a therefore. So point, platelets will clot the blood if there's a cut, and therefore, or explaining that, this will allow the boxer to continue the fight if there is a cut. Part B, state one function of plasma. So plasma has the function of carrying lots of different things. So nutrients are carried in the plasma, also waste products are carried in the plasma. So one thing you could say, one function would be to transport nutrients, also transports hormones, waste products. Okay, part C. To ensure blood flow to the working muscles, vasoconstriction occurs in some of the boxer's blood vessels. So what that's talking about there is blood shunting, where certain capillaries of the body or blood vessels of the body will vasodilate and allow blood through, and certain blood vessels of the body will vasoconstrict and stop the blood going to certain areas of the body. So to state the meaning of the term vasoconstriction, well, that's simply where the blood vessel or the capillary narrows and constricts to stop blood going through. This means the narrowing of blood vessels, which reduces blood flow. Part D, state, given an example of each, 2 different methods used to reduce the risk of injury during a boxing match. So we're looking at 2 different ways, 2 very different reasons, and an example of each, how you can make sure there's less injuries when boxing. So one method would be to wear protective clothing, and the example would be, for example, a gum shield. Okay, another very different way to prevent injury would be to have a referee to officiate the fight. And the example would be so an example, this makes sure there are no punches below the belt. So there we've made our point and then given our example for 2 very different ways of reducing injury. Another way you could have reduced injury would be to check that the ring is clear and there's nothing in the ring that could cause an injury. Another way would also be to make sure that the athletes have warmed up appropriately and done their stretches to make sure that they're not in danger of pulling a muscle. So there's lots of different ways you can prevent injuries: protective clothing, following the rules, and having officials, making sure that you've warmed up properly, and also checking the area to make sure that there's no risks and no hazards that could possibly be tripped on. Question 6. Figures 5 and figure 6 show the percentage of oxygen and the percentage of carbon dioxide and nitrogen in inhaled air and exhaled air from a long distance runner whilst training. And what the question's asking us to do from this data is analyse, using the data in figure 5 and figure 6, the difference between the runner's inhaled and exhaled air. So we should have a knowledge from our revision of the composition of inhaled and exhaled air, but really this question is telling you all the answers. You've just got to analyse it, which means state 2 obvious facts. It's 2 marks, 2 obvious facts about these pie charts. And the way to do that is to also state the percentages as well when you're doing so you'll be very, very clear about the facts you're making. So we need to just make 2 facts about the difference between inhaled air and exhaled air. So this is what I would write for this answer. So just being clear, I've stated what's happening with the oxygen. There's 5% less in exhaled air compared to inhaled air. And also with the carbon dioxide, there's been an increase from 0.04% in inhaled air to 4% in exhaled air. So I've been clear to state two obvious facts because I'm analysing about my pie charts. However, I'm also clear to be very specific and give some of the percentages and even the difference in the numbers there with a simple sum to show the data. So part B asks us to explain why there is a difference in the amount of oxygen and carbon dioxide in inhaled and exhaled air whilst doing the long distance runner. Whilst the long distance runner is training. So here we have to explain, and we're going to say what's going on with the oxygen and how or why, and what's going on with the carbon dioxide and how or why. So we have So oxygen is needed by the runner, and this is so that they can work aerobically to make the energy. Carbon dioxide is a waste product and is not needed by the runner. It's created by aerobic respiration in the working muscles. Question 6, part C. The graphs in figures 7 and 8 show the runner's depth and rate of breathing at rest and during exercise. So here we have figure 7 showing at rest, and this has got shallow breath of breathing in and breathing out, in and out here on the graph, and it goes up to 0.5 and down to 0.5, and they are less regular. And then during exercise, taking deeper breaths because it's going all the way up to 2 and down to 2 and more regular. And the question, the first part, identify using the data in figure 7 the name of the lung volume labelled A. And here it says A on figure 7, and it's from the top to the bottom showing one breath, so breathing in and then breathing out. So that would be your tidal volume, which is the volume of air in one breath. Next part of the question, explain 2 reasons why figure 8 represents the runner's breathing during exercise. So why does figure 8, this one, represent how somebody would breathe during exercise? Well, during exercise, you would need to breathe deeper breaths, so a bigger tidal volume, and you would also need to breathe more frequently, so a higher breathing rate to make sure you're getting enough oxygen to your muscles and removing the carbon dioxide created by aerobic exercise. So the question, we've got to give 2 separate reasons. We're given a point and an explain for each reason. So reason 1, figure 8 shows a higher tidal volume, that's the first mark, and then to explain that one, this is shown by the deeper lines which represent breathing in more and out more. Reason 2, Figure 8 shows a higher breathing rate. This is shown as the lines are closer together on the graph. This shows more breaths per minute. Question 7. Statements A and B in Table 2 show how energy is released aerobically and anaerobically. So A is the equation for aerobic respiration, glucose plus oxygen. It gives carbon dioxide plus water plus energy. And B is the equation for anaerobic exercise, glucose equals lactic acid plus energy. but it doesn't tell you in the table which one is aerobic and which one is anaerobic. You would need to know this from your revision. Justify why statement A in table 2 shows aerobic energy release. Well, hopefully if you've been studying GCSE PE, you will know that aerobic respiration requires oxygen. So that would be your first mark, to say that aerobic respiration requires oxygen, and statement A clearly has that. And your second mark would come from saying that the byproduct would be carbon dioxide of aerobic respiration. Or alternatively, you could say that in anaerobic respiration, the byproduct is lactic acid, or anaerobic exercise has no oxygen. So this would be enough to get the 2 marks. Statement A is aerobic energy release because it has oxygen, that's worth 1 mark. It also has carbon dioxide as the byproduct, that would be the second mark, but I've just put this extra statement in here. Statement B has no oxygen and must be anaerobic, and you could also go on to say that statement B, the anaerobic respiration, also has lactic acid as a byproduct. So on this question, you wouldn't be marked down for writing more facts than you need, but you're just making sure that you're gaining the 2 marks on the question. Part B. Explain 2 functions of the cardiovascular system that enable a long-distance cyclist to perform well in their event. This is worth 6 marks, and we need to give function 1 and then down here function 2. So here we need a point, explain, benefit to gain 3 marks, and the same on function 2. So a function of the cardiovascular system to enable a cyclist to perform well would clearly be to deliver oxygen to the muscles. One function of the cardiovascular system is to deliver oxygen to the muscles. This allows them to work aerobically. So there's point and then explain, and now we need the benefit, or therefore. So therefore the cyclist will be able to keep going without fatigue. The second function So we have the point. Another function of the cardiovascular system would be to remove waste products such as carbon dioxide and lactic acid. Then explaining, these are produced as a byproduct of exercise. And then the therefore, or the benefit, this will stop the muscles from aching and help the performance. Question 8. Lever systems are made up of 4 parts. One of these parts is the lever. State the other 3 parts of a lever system. So in a lever, we have the lever, we have the fulcrum, we have the load, and we have the effort. Third-class levers work at mechanical disadvantage. Explain the term mechanical disadvantage. So to explain the term mechanical disadvantage means that the lever is harder to lift than one with mechanical advantage. So that's making the first point and then explaining it. This is because the load arm is longer than the effort arm. So in a third class lever, you would have the fulcrum, the lever, and the load, and then you would have the effort here. So the load arm would be all the way here from the load to the fulcrum, and the effort arm would be here just from the effort to the fulcrum. So this would be the example, a third class lever perhaps in the arm, where the fulcrum is the elbow, the load is the weight of the arm or whatever you're holding in your hand, and the effort here would be the bicep muscle pulling up that lever. So the lever works at mechanical disadvantage, and the load arm is certainly longer than the effort arm. Question 9. Movement patterns occur in planes and around axes. Complete Table 3 by stating the plane and axes for the tuck somersault and stating the plane and axes for the full twist. So in the table here we've got to state, which means give a one key term answer and don't write a full sentence. We need a plane and we need an axis, first of all for the tuck somersault and then for the full twist. So the axes and plane for the front somersault would be the sagittal plane, kind of going in a forwards direction here, and the axes would be the frontal axes, and that would be going through the body like this on the sides. And a bit easier to see in this picture, the full twist would be going in the transverse plane, which is around the body there, and the axes would be going from top through like this, and that would be the vertical axes. Question 10. Components of fitness help us to perform well in sport. Complete Table 4 by A. Stating the component of fitness being described, and B. Giving specific example of how the component of fitness is used in a sport of your choice. So first of all, we need to state the component of fitness for the description. The ability to exercise the entire body for long periods of time without tiring is cardiovascular fitness. Keeping going in a very long tennis rally. Second description, the ability to change the position of the body quickly while maintaining control of the movement would be agility. Example, weaving in and out of defenders when running with a rugby ball. The final description for this question, the ability to retain the body's centre of mass above the base of support would be balance. Example, a gymnast holding position when doing a handstand. Question 11. Warm-ups are an important part of preparing for activity. Complete Table 5 below by stating 2 phases of a warm-up and how each phase helps a performer prepare for their activity. So there's actually 3 phases that you would have learnt to the warm-up. The first one being a pulse raiser, the second one being a stretch session, whether that be static or dynamic stretches, and the third one being a skills practice, practicing the passing or dribbling or whatever skill you would be doing in the sport. So let's go for the first one being a pulse raiser. And essentially this means to go for a jog or do an exercise which is going to raise the heart rate. And the reason this is going to help them prepare for the activity is because it will increase the oxygen delivery to muscles. Second part of the warm-up we could talk about would be stretching. There you could put, this would be so that would be to increase the range of movement at joints. You may also get a mark for saying this would reduce the chance of pulling a muscle. I think that's what a lot of people would probably write there, but that would be a really good answer. So stretching to increase the range of movements at joints. Question 12 is a 9-mark question. Eric is a 100-meter sprinter. He trains regularly using fartlek training, plyometrics, and sprint interval training. Evaluate the likely effects of these training methods on Eric's fitness for sprinting and his sprinting performance. So we have 3 different methods of training: fartlek, plyometrics, and interval. And Eric is a sprinter. And what we have to do is evaluate. So we have to sort of say which ones are the best or which ones are the most effective and perhaps which ones are the least effective, because it's evaluate, making that decision. And on Eric's performance as a sprinter. So first up, the ones that we know are going to be excellent for a sprinter are going to be plyometrics, because it's fast, explosive training, which is going to be ideal for bursting out of the blocks and powering to get some drive on your sprint technique. And also interval training will be good because it will get him working in short bursts, working anaerobically, which will be increasing his speed and his ability to work anaerobically in the 100-meter sprint. And fartlek will be good for his fitness, but actually probably the least effective of the 3 for making him faster in the 100-meter sprint. So we need to get that into our answer as well as an evaluation, particularly when we're looking at the conclusion for the question. So we want to be writing in a certain style, giving a point, examples, and explanations and benefits. So this is an attempt at this question. Eric will benefit from plyometric training. This is explosive training which involves powerful jumps and strides. For example, doing box jumps and jumping into lunges. This will build the explosive power and help Eric to burst out of the blocks faster and with more force in the sprint races. Interval training will also be very good for Eric's sprinting. It will involve periods of fast sprints over short distances, followed by periods of rest to allow the muscles to recover. This will help Eric to improve his fast twitch muscle fibers, as well as his ability to work anaerobically during the sprint. His overall speed when sprinting will improve. Doing fartlek training would be less beneficial to Eric. Fartlek training is varying the speed of running. Although this would improve Eric's fitness, it won't make a big difference to his speed. It may cause him to slow down as he would be working on endurance rather than explosive power and speed. Overall, Eric should focus on training his interval and plyometrics, as these will have the biggest impact on his speed. He must also be careful not to overtrain, as plyometrics can be hard on the joints.